everyone, my name is Nari Beatty, and the research focus regarding this poster is based around diet-induced obesity, enhancing anxiety-like behavior and novel feeding conditions, and after the removal of a high-fat diet. So overall, this study examined how diet-induced obesity impacted preference for novel foods and behavioral measures of anxiety, following an abrupt dietary change. So male and female mice were given access to a high or low-fat diet, 60% kcal or 10% kcal, for 6 weeks, leading to diet-induced obesity in high-fat groups. Novelty-induced hypophagia was conducted to measure the neophobia, or fear of new diet, caused by stress. Then the mice fed high-fat diet had their food swapped to the low-fat food, as anxiety-like behavior was measured using the elevated plus maze. So overall, we hypothesized that diet-induced obesity would elevate anxiety-like behaviors from the removal of the high-fat diet during the elevated plus maze. So if we take a look over at the graphs, in figure 1, we have chart A that shows the mice placed on a control low-fat diet or a high-fat diet for 6 weeks. Then novelty-induced hypophagia was completed during ad libitum feeding, where the diet was available at all times. Afterwards, the high-fat diet replacement started for 1 day or a week, followed by the elevated plus maze. In chart B, we see that the average daily caloric intake is measured, and in chart C, the body weight in grams is shown for both groups at weeks 1 and 5 for males and females in chart D. In figure 2, chart A shows the sucrose intake measured in kcals and the latency to approach the cup in chart B during the novelty-induced hypophagia. In figure 3, chart A shows 1 day after the high-fat diet replacement, where the high-fat fed males and females almost fully restricted the kcal intake. In chart B, we see the elevated plus maze reflects the total percent of time spent on the closed versus open arms for males, and in chart C for females, 1 day after replacement. And then lastly, in figure 4, chart A shows the intake for high-fat fed males and females over 1 week of high-fat diet replacement, and chart B shows the elevated plus maze results as percent duration on closed versus open arms for males, and chart C for females. So to discuss some findings from our data, we discovered that consuming a high-fat diet reduced sucrose intake due to reduced food intake under the novelty-induced hypophagia conditions. We also noticed that both high-fat and low-fat mice spent less time in the open arms of the elevated plus maze, which reflected some anxiety-like behaviors. Within the elevated plus maze, we found that the anxiety response was the same within both high-fat fed and control mice. However, during the novelty-induced hypophagia, high-fat intake altered preference for the palatable food, which was a 60% kcal, whereas the high-fat diet replacement induced food-related anxiety, resulting in the high-fat fed group refusing to eat the non-preferred food, which was the 10% kcal. And then lastly, we noticed that anxiety-like behavior due to the high-fat diet replacement was displayed by voluntarily restricting intake within the high-fat fed group, showing voluntary food restriction when less palatable food was available. So to conclude, the high-fat diet intake induced undesired sucrose intake during novelty-induced hypophagia, whereas the high-fat diet replacement with the less energy-dense food, which was a 10% kcal, promoted food-related but not general anxiety-like behavior, exemplified by voluntarily reduced intake.